A lot of candidates will come to Iowa and say the same things. The question is, have they done it? In a liberal state, I reduced spending in real terms for the first time, took on the government unions and won, appointed a conservative Supreme Court, and passed healthcare reform the right way. No mandates, no takeovers. If I can do it in Minnesota, we can do it in Washington. I'm Tim Pawlenty, and I approve this message.
Well, that is presidential hopeful Tim Pawlenty. Those who are running for president have made health care repeal a major part of their campaign. Former Massachusetts Governor Mitt Romney has come under fire for his stance on health care. Now, when he was governor up in Massachusetts, he put a health care plan in place for the state that President Obama used as a map for the national reform law. At the first GOP presidential debate, Governor Mitt Romney here addressing the controversy.
Now, there's some similarities and there's some big differences. Obamacare spends $1 trillion. If it were perfect, and it's not perfect, it's terrible, we can't afford more federal spending. Secondly, it raises $500 billion in taxes. We didn't raise taxes in Massachusetts. Third, Obamacare takes $500 billion out of Medicare and funds Obamacare. We, of course, didn't do that. And finally, ours was a state plan, a state solution, and if people don't like it in our state, they can change it. That's the nature of why states are the right place for this type of responsibility.
Again, that's former Massachusetts Governor Mitt Romney speaking at that presidential debate. Now, there are cases all over the country of people needing health care to treat their illnesses and not being able to get it. And one of those cases is right here in Gwinnett County. Ronnie Monticelli was diagnosed with a rare form of cancer. He has found a doctor who specializes in the treatment of the cancer, but he cannot afford it without insurance. CBS's Leslie Tanner speaking with Ronnie and his wife about their struggle.
$2,925. Jennifer Monticelli looks through her husband's medical bills. In just the last 7 months, she says they've racked up.
I believe my medical debt is probably around $300,000.
Before he got sick, Ronnie owned his own plumbing company, and with 4 kids, says he couldn't afford private health insurance, and he never needed it until
was having a pain in my lower abdomen.
That pain turned out to be stage 4 goblet cell adenocarcinoma, a rare aggressive cancer that causes tumors to grow in your appendix and colon.
And eventually they're going to grow and they will block my colon, and I'll die.
The couple found a local specialist that can perform the unique surgery that could potentially save Ronnie's life, but they have no way to pay for it. They say they've applied for every program they can find and were approved for Medicare, but federal law requires a 2-year wait for coverage. Although there are some exceptions, cancer isn't one of them, and Jennifer says she's speaking out now for more than just her husband.
Other people need help too, you know? I mean, no one should die like this.
Ronnie says the process makes him feel
cheated because I've been working since I was 15 years old, and I've contributed all these years. I've paid my taxes, and now when I need the help of Social Security or the government, it's not there for me.
And Jennifer says although it's been hard,
it's not easy to see my kids, you know, crying.
She still believes it will all work out.
I hope. What am I supposed to believe?
We spoke with Haley Schwartz, who is the director of Atlanta's Legal Aid's Cancer Legal Initiative and who is now working to help the Monticellis.
It happens all too often to individuals, particularly those who are disabled, are trying to do everything that they can to become eligible for the services that they are entitled to or they may be entitled to, and they're sick in the process.
All right, and as for the Monticellis, officials at DeKalb Medical Center are now working with the couple to see if there are any programs that are out there or services that could help them out. Well, after this story aired, we asked you on Facebook if you ever think the U.S. will see health care reform. And we got a lot of responses from you. Haifa says this: health care should not be an issue. It should be provided free of charge to all citizens. Teresa disagrees. Health care is not a right. People should be able to afford it, but a lot depends on their life decisions. If they go out to choose and buy an iPhone, computer, and flat screen over health care, that is a choice. And John writes, health care isn't the problem. The U.S. has the best health care in the world. The problem is figuring out who is going to pay for it. We invite you to join in on the conversation right now on Facebook. We are asking you if the U.S. will ever see health care reform, just like Public Affairs on Peach on Facebook. And when we come back, the cost of the health care law to small businesses.